All right. Hey there, Epidemics. Welcome back to another exciting day of discussing horrible things. All right, so there is a quiz and a journal entry that are posted and are due before midnight, Sunday, February 13th. And I've put up a module or content area that has a lot of information about the project. And I've gone ahead and put up a place where you can submit ideas for what topic you want to do and what kind of project you want to do. That's not due till March 6th, so you have several weeks still, but it's up there for those of you who have already been thinking about it and already have some ideas. So this showed up, I spotted this morning, and this is mortality due to drinking. And you can see that while there were ups and downs for the few years before COVID, once COVID shows up, the number of people who are drinking themselves to death goes up quite significantly. This is an example of the psychological toll that pandemics take on a society. And these are the kinds of deaths that generally are not counted. Nobody is saying that the extra, let's say, 1,000 people who died in the month of January 2021, nobody is counting those in the death toll. That's something I think we need to take into consideration, and it's one of many reasons why I'm very angry about all the people talking about how we found a new normal, because I just don't want it to be normal that we have so many thousand people dying every day. I don't think that's acceptable. So I had to get on that rant. And now I get to get on a rant about HIV too. So we've been talking about how the society in the early days of the AIDS pandemic kind of made things worse. And so I want to give you some specific examples of things that used to be legalized discrimination against people who identified as LGBTQ, etc. So certain homosexual acts were illegal until 2003. This specifically focused on anal sex, and you could be doing this in your own bedroom, in your own house, and if somebody reported you to the police, you could be arrested for it until 2003. During the 80s, police would often raid gay establishments. So a gay bar or other meeting place where gays would go to meet other gays, the police would come in and arrest everybody. They were legally prevented from holding federal jobs. Homosexuality was considered a threat to America. And the idea was that other foreign countries, if they found out you were gay, could hold that against you and use that to manipulate you to do things to the advantage of these foreign countries. And openly gay men were not allowed to immigrate to the United States. In fact, if you were HIV positive, you weren't allowed to enter the United States until 2009. A lot of this stuff just, it's persisted much longer than we seem to realize, or that I seem to realize. The government also shut down what are called bathhouses. Bathhouses are places with hot tubs and saunas. And apparently, in some of these bathhouses, it was a place for gay men to meet and have sex.
Professor?
Yes.
Are you typing anything?
Not right now.
Okay, I was just going to say, it looked like you were, and I was going to say I can't see it. I was just wondering.
Oh, I've got notes here.
Oh, you do?
That's what I'm looking at. I'm making sure I've covered everything.
Oh, I don't see it. Oh, okay. Oh, never mind.
Yeah, my notes right
here.
Okay. Now, we think, okay, those were the bad old days. This is the modern progressive America, and we're much more accepting of LGBTQ. And certainly some parts of society are definitely more accepting, but not everywhere. Men who have had sex with another man in the past 12 months are still banned from donating blood. This was originally done because we couldn't test for HIV in the blood supply, and it was a good precaution when we couldn't test for HIV in the blood supply. But we've been testing that blood supply for decades now, but there's still a ban in effect. And in fact, women who have had sex with a man who had sex with another man are also banned from donating blood. So we haven't gotten rid of all the discrimination, all the open and out there discrimination. Worldwide, the US is a pretty good place compared to a lot of countries. 48 countries still ban entry to people who are HIV positive. That includes tourism, guys. If you're HIV positive, there are lots of places that you can't go as a tourist. And around 70 countries around the world, it is illegal to be LGBTQ. And in 11 of those, being homosexual carries the death penalty. And 6 countries have killed people using this law in the past few years. So there are still places in the world where you can be executed for being homosexual. The American travel ban, not surprisingly, was lifted by Obama. So people in the early days of the HIV pandemic were terrified of catching it. And a lot of people, I mean, the early days, we didn't know the details of transmission, but science figured it out pretty early. It's just that a lot of people didn't believe the science or didn't listen to the science. And so people were concerned about things like sitting next to somebody who was HIV positive or sharing a drink with somebody who was HIV positive. And that continued even after it was obvious that it was pretty much sex. That's pretty much how HIV is transmitted. And of course, in these early days, there was no treatment. So there are cases of hospitals refusing to treat HIV positive. Churches would ban HIV positive people from coming to church. A friend of mine's mother quit going to church because they let an HIV positive person come to the services. She literally switched churches. Schools would refuse. Julia, go ahead.
Sorry, I'm interrupting again.
No problem.
I was so like when you going back to hospitals refusing to treat HIV patients, don't they take an oath or like doctors take an oath or something?
Yes, they do.
They have to do that. Like they have to treat anybody no matter.
The Hippocratic oath, I don't remember the details of what it says, but the idea is they're supposed to treat anybody and they're supposed to do no harm. But not everybody takes the oath seriously. And I mean, that's understandable. If you're treating an HIV positive patient, you're giving them injections or doing surgery on them, that puts you at risk for getting HIV, right? And in the early days, that was a death sentence. So you can kind of understand that, but yeah, doctors really should be willing to treat anybody who needs treatment. That's the way it should be.
I just don't understand, I guess, like the mental aspect of like how people can like live with themselves if they turn away someone like that. I don't know. I don't know. I'm just from a family who like we just like, you know what I mean? We accept everyone. It doesn't matter like what race or sexuality. So it's just it's all really hard for me to understand.
Yes, yes, it is. One of the things in some people's brains that allows them to do this kind of stuff is a process called othering. And so the idea that these people have is that my people are X, Y, and Z. Let's use an obvious example. White, heterosexual, cisgendered, and Christian. So people who don't tick all of those boxes are others, and we have to defend our group against these other groups.
Yeah.
We do that either by deliberately harming them or by discrimination. And it's probably a long-standing a long-term mental concept that comes from early in our evolutionary history, where if your family group runs into another family group, you don't know anything about them. You don't know if they're going to kill you or kidnap your children or whatever. And so you automatically divided the world into my group and other people. And some people still feel that way. I don't understand it either. I'm definitely in the camp of a person is a person, and that's yeah, that's my best understanding. Hi, puppy.
He barks at anything that moves.
Does that kind of help you? Maybe.
Yeah, definitely. Thank you.
You're welcome. So hospitals, churches, schools would all ban people who were HIV positive. And my dad had a story from this time. A friend of his had a son with HIV. And he had a medical crisis. The EMTs arrived, but refused to treat the HIV positive son. They just said, we're not treating him. And they told him that the family should just let him die. They literally told the parents, you should just let your son die. He's HIV positive. The horror, I can't imagine how horrifying that must be as a parent to have somebody tell you that your child should just die. I really can't understand that one. Okay, so we're all mad now, right? At least I am. Okay, so these effects of homophobia just made the crisis worse. People who were gay were afraid to talk about it because they could be legally discriminated against. The government refused to acknowledge it or deal with this epidemic because it affected the other, the gays. So that contributed to the problem. And the next group that started showing up with AIDS were IV drug users. Well, we all know this is another group that we can shun. The idea was if you got HIV from using IV drugs, you deserved what you got. Lots of drugs that are illegal because they are incredibly dangerous. You know, heroin is illegal because it's very easy to kill yourself with heroin, for example. Other drugs are illegal for moral reasons. Pot was illegal until very recently, and still is in some places in the US, just for moral reasons. Pot is a low-risk drug. It does increase your risk of some cancers, just like smoking does. Oral pot probably does not increase your risk of those cancers. So edibles are much, much safer than smoking. And here I am, once again saying, yeah, you know, if you do what you want to do, as long as you're not hurting anybody else. We ban drugs that are deadly because they're deadly. And we want to, theoretically, we want to protect people, but there's some moralizing going on. All right, now I want to get, I'm gonna clear these drawings, clear the text there. As we go through this semester, we are going to see some consistent themes that have an impact on the course of epidemics. Globalization and travel. We're going to see how this can spread diseases to new places. Poverty and oppression tend to make epidemics more likely and make them spread more. So there's a couple of reasons for this, one of which is people who are impoverished, if they live in a place where they can go hunting, will go hunting and get exposed to wild animals. And of course, one of the fallbacks for a lot of people to make money is prostitution. And prostitution is a high risk job that increases the likelihood that you're going to spread things, especially things like HIV, or contract and spread. Lack of access to health care. With HIV, there wasn't always information available. I misspelled available, didn't I? We'll see this again with other epidemics. With HIV, condoms were or are not always available. They're pretty accessible in the United States, but there are places in the world where that's not the case. And it certainly was not the case early in the AIDS pandemic. I mean, even now, if you live in a small town, you know the druggist, they know you're buying condoms. If you live in like Massachusetts, so what? We're pretty accepting in Massachusetts, but there are places in the country where if you're unmarried and buying condoms, you're going to get judged and talked about. And in a small town, that can be really, really hard. Condoms reduce the risk of HIV by about 70%. So they're not 100% foolproof, but they do significantly reduce the risk there. With HIV specifically, we're going to see the role of culture, but with HIV, it's the repressed culture. In the United States, white people do not talk about sex. Right? Even educators and doctors can sometimes be squeamish about it, especially if it's not heterosexual penis and vagina sex. You know, doctors don't always want to talk about anal sex, for example, and why it's a problem and how to protect yourself during that kind of sex. So that's a real problem. And some men even refuse to use condoms. Apparently it's not manly or something. I'm not quite sure what the problem there is. That can be an issue. The early public message about protecting yourself from HIV is avoid the exchange of bodily fluids. What the hell does that mean? Right? Especially early in HIV, when at that time period, sex was considered only acceptable between a husband and wife. And of course, there are still lots of people in the United States who still have that idea. So you end up with a lot of confusion. And of course, going along with that was, you know, the homophobia problem. So as we go on, we will see globalization and travel over and over again and its role in epidemics. Poverty and oppression go hand in hand with pandemics. Poor healthcare, especially poor information, has a huge, huge role in epidemics. And culture can play a big role in both the emergence of epidemics and the response to epidemics. So we're going to see these themes over and over and over again. Okay. Good time to take a snap. And then we're going to turn the corner on HIV. And we're going to quit talking about all the horrible things that happened and start talking about when things changed. So HIV started out being a gay disease, gay men's disease. And then it went into IV drug users. And we can, well, I can't, but some people can comfortably shun those groups because they're clearly other. But in 1984, half of all hemophiliacs were HIV positive. So hemophilia is a genetic condition that where your blood doesn't clot correctly. So you tend to bleed a lot more, and you're at risk for losing enough blood that you can die from it. You can bleed to death. And in the early 80s, most hemophiliacs were treated using a protein called factor VIII that was extracted from donated blood. So that gives you an idea. The blood supply did have HIV in it, and hemophiliacs need so much of this factor VIII just to stay alive that they got infected in huge, huge numbers. So receiving HIV positive blood or blood products is very, very high risk. And hemophiliacs were receiving these products, you know, multiple times over and over and over again. Even after testing was available. Most blood banks did not start testing until they got sued. And the lawsuits were more expensive than the cost of testing. And yes, this is another H of HIV. Homosexuality, hemophilia, Haiti. Okay. Take a picture of this because we're now going to talk about this young man. This is Ryan White. In the mid 80s, he became HIV positive. He was a hemophiliac. He got it from the treatment to help keep him alive. And in the 1985-86 school year, the school superintendent denied him admittance. You can't come to school.
Who informed, like, even with the ambulance, you were saying that they didn't pick up the guy that had, who's telling these people that they're HIV positive for them to be discriminated against?
I don't know about with Ryan White, but I know with like the ambulance, it could be one of two ways. One, hey, you're going to be handling my son.
Okay.
There might be bodily fluids. I want you to protect yourself and be careful. Or it could be that he was having the pneumocystis pneumonia or Kaposi sarcoma, or had something that was obviously an opportunistic infection that was tending to occur only in HIV positive people, or very rarely in non-HIV positive people.
Can you define that term, opportunistic infection?
Yes, I can. This is a disease that does not cause symptoms in people with a healthy immune system. It takes advantage of the opportunity to infect when someone has a weakened immune system. So the pneumocystis pneumonia, you know, if you get exposed to it and your immune system is normally functional, you're going to be fine. If your immune system is weakened through age or AIDS or chemotherapy, then it can cause pneumonia. And that's why we call it opportunistic. Does that clear that up, Nathan? Nate?
Yeah, no, either one's fine, Nate, Nathan, as long as it ain't Nathaniel. But appreciate you defining the term. It's an important term, everyone. So
Yes, it is an important term. I wonder where you heard that term. Okay. So on the first day of school, Ryan was able to listen to class via telephone. Now, if you're not, you know, closer to my age, during this time period, there would be a telephone in the classroom and it hung on the wall. So he's listening like if you put your phone across the room and he's trying to listen to classes.
Zoom. So that's essentially the first Zoom. That's the first remote learning.
Yeah. Zoom's gotten a lot better since then.
He's a pioneer, you know, RIP to Ryan, but he's a pioneer to what we're doing right now.
Yep. So the principal upheld this decision and says, no, Ryan White can't come. The state in November, the State Board of Election, I'm sorry, School Department of Education says Ryan must be allowed in school. The local school district appeals the ruling. February, the State Department of Education comes back and says, no, you really do have to let him in. And we're going to have a health officer determine if it's safe for him to come back. February 13th. The health officer says it's safe. February 19th, the county judge issues an injunction to prevent Ryan White from going to school.
Do you know what state this was in?
Indiana.
Okay, makes sense.
Funny
Okay.
thing, Professor,
Yes.
I definitely learned about this in like middle school many moons ago. So I've seen this picture. It's just ironic to see it again now.
Well, I'm glad you heard about him already, but yeah, it's quite the story. Okay, I'm
Definitely.
gonna have to erase some of this stuff. So screenshot time. Okay. So February 24th, White goes to school. A different judge that afternoon issues a restraining order against Ryan White. You know that a lot of kids were going through similar things and their parents didn't have the resources or the willpower to help the fight. A lot of respect for his parents for supporting him in his fight here. March. There was a school fundraiser to fund legal ways to keep White out of school. April 10th, a circuit court judge says, screw y'all, White is allowed in school. And that was kind of the end of it. I mean, it took almost a whole school year. There were more appeals, but the Indiana Court of Appeals said, no, we're done with this. This is ridiculous. In February of 1986, White went to school for one day in the middle of all this court proceedings. And on that day, 151 of 360 students at the school were out sick. Half the school, basically. There we go. He tried to get a job as a paper boy, and people on his paper route canceled their subscriptions. So in 1986, 1987 school year, the school had to let him back in. The state court had decided the case was done. He had a special restroom.
So like kind of like what transgender people have now, he's a pioneer. This is the second thing he's trendsetted on, Ryan.
Yep. They also required he use disposable utensils in the cafeteria. He was not allowed in gym. Threats of violence and acts of violence came up against the family. Their house was shot at. They ended up having to move because of all of this. I mean, if people are shooting at your house, of course you have to move. And yes, Ryan White was a pioneer. He is the kind of person I would call a hero. Ryan White died in 1990 at age 18.
Yeah, I was just reading about it. I think what's even sad is it was 1 month before he graduated high school. I think he died from like an acute respiratory tract infection that he wasn't able to fight off. It's sad.
Yeah, it's very sad. It's very sad.
So he had no treatment at all pertaining to his ailment, like nothing.
During this time period, HIV was still a death sentence.
Unless you're Magic Johnson.
Nah, nope. This is
Oh
before
yeah, no, he didn't get it till the like 91. Yeah, you're right. You're right.
Wow, that sucks.
Yep. All right. That's the end of the horror stories of discrimination. So, am I going to ask you specific questions about this story and these dates? No, I might ask you, I might give you a journal prompt to talk about the Ryan White case. Okay, so if you want to screenshot, we're moving on.
He predates GoFundMe. We couldn't, the community couldn't even help, like I don't even know what the funds would have been for, but it just, we want to give and help. And this is heartbreaking.
Yeah. Yeah. I feel like the community you live in should be supportive. And they were literally the opposite. Okay, so we're going to talk about the discovery of the virus, the biology of the infection, treatments, and that kind of stuff. So I want to talk about the FDA. The FDA is the Food and Drug Administration. And they regulate food and drugs. So they make sure, or they're supposed to make sure that food is safe and that ingredients are labeled accurately. They don't say anything about healthy, but if you buy a bag of granola, it will tell you on the back everything that's in there. And the FDA regulates that and requires that labeling. They also control which drugs are on the market. And the process for approving drugs to be used in humans is an expensive, multi-year, very intensive testing process. It must be safe. So it has to have a low rate of serious side effects relative to the severity and other treatment options for the disease. So if you've got cancer, chemotherapy has some nasty side effects, and you will feel like you like crap while you're on chemo. You'll have problems with, you can have problems with digestion, with pain, with fatigue, all of that stuff, but it's saving your life. So it's safer than not being treated. And it must also be more effective than anything else on the market. So you can't make a product like Zantac that is equally effective as Zantac and hits the same population. Nate, go ahead.
How does that work with the over-the-counter like generic drugs? And two, also I was researching the FDA. Did you know that they don't do individual research? They rely on research provided from the other companies or
Yes.
yeah, manufacturer.
Yes, yes, that's a good point. Let me add that. Research is done by the companies. And generics. Okay. I'm going to come back to generics in just a second. So, new drugs have to be better than existing drugs or target a different population. So there are people who certain medications give them worse side effects. They may not be able to tolerate those side effects. And that is a new market that some drug company can, target and try and develop a drug to treat those people and bring a new drug onto market. For I think it's 7 years, but I may be off on the number of years there. For 7 years after a company releases a drug, after it's FDA approved, the company that did the research has a monopoly. They are the only people who can sell that drug, which it's hard on those of us who are having to afford expensive drugs, but the companies had to do all that research, and that's very, very expensive. Nate, your hand's up again. Go
Just
ahead.
to add on to that, the patent, I don't know if it's considered a patent, but I'd say that's a major part of the reason why pharmaceutical drugs are so goddamn expensive is because they can like exact a monopolistic like control over it, and they can just set whatever price they want to.
Yes.
Well, within parameters.
Well,
I don't even know.
have you looked at the prices of insulin over the past few years?
I was looking at the price of PrEP after researching about the HIV, and that stuff's ridiculously expensive. So, I mean, but there's so much money and well, that's another conversation, but I mean, it's so corrupted.
That's a American problem. Drugs cost a lot more money in America than they do in most of the developed world.
That was in the reading. I didn't really understand why though. Why? Rather, not why it was in the reading. Sorry. Why do drugs cost more here?
Lack of government regulation on pharmaceutical prices. That and I don't want to get too political, but I mean, look at the super PACs, who's funding certain politicians. Just follow the money. That's all you got to do. And it's disgusting, and people are truly suffering for it.
Mm-hmm. Yeah, it really is lack of government regulations. In most developed countries, most wealthy countries, the people don't need health insurance because there is a single payer system. And that single payer system is usually run by the government. And because it's such a big group controlling the healthcare industry, they can set the prices for the drugs. And in a good country, the government says, we care about the people, not just profits. Nate.
And I will say, like, in regards to like the free healthcare thing, my opinion's changed on that because I don't know why. I didn't think it would work in America, or because like you look at it in other countries. Well, I mean, there's one comparable one in Canada, but a lot of the other countries, they're like homogenous, smaller like groups of people. But I mean, I'm not gonna lie, I'm a veteran, I'm disabled, I get free healthcare, and it really like opens your eye to it, and it's sad, I mean, that is one of the things that like I changed my opinion on, and hopefully we can get to that point, I mean, A lot of people just don't go to the emergency room because they don't want to pay the bit, they can't afford the bill, or something so stupid like that. So
Yep. Yep. Well, hopefully we will get a better
Could I,
healthcare system. Jerry,
oh,
did you
could
want
I,
to add?
could I just say something that's kind of related to this?
Absolutely.
So like, I have like very limited experience when it comes to like the healthcare system and stuff like that. But a couple weeks ago, I got an infection in a wisdom tooth that was starting to grow in,
Mhm.
and I had to get it taken out like as soon as possible because it was extremely painful. And in order to like get it taken out in the first place, like I had to just jump through like all these hoops with like the insurance company and like
Mhm.
all these like people just to like get it taken out. It was ridiculous.
Yeah. And that's something that you would think an infected wisdom tooth would be kind of a, oh yeah, of course, let's get it out as soon as possible. Not, okay, you have to fill out all these insurance forms and so on and so forth. But yeah.
Yeah, we had to like call up the insurance company, and then we had to like get a referral, and then we had to get the referral so we could get a consultation and like blah blah blah. It was
Mhm.
just, it was an agonizing process.
Yeah. If you've never had a major health problem, you may not understand just how bad the health insurance industry is in the United States.
I
It's,
will say though that like one of the minor downsides of like the public healthcare is the wait times. It's not always the case, but I mean it is true. Like some people wait like 3 hours to get seen by a triage. I don't know what the programs are. I mean it differs.
okay, Nate, go look up wait times in the United States. Have you ever been to the emergency room?
6+ hours.
Yeah. Yeah.
And
It's
they closed
not,
Union Hospital in Lynn also, so it's worse now. You know, Union Hospital is on Linfield Street, so it's even worse now.
Mhm.
We say that first part again, Jared. I kind of
They closed Union Hospital in Lynn, so it adds more volume to the other hospitals now, like Salem and Beverly. So the wait times have increased. And they're probably gonna put condos there or something. Watch.
yeah, probably. Okay. So drug companies do have a monopoly for the first, I think it's 7 years. I may be off on the number of years. After that period, other companies can make the same drug, and those are the generics. And so when people say generics are just as good as the name brand drug, they're often exactly the same drug. And they still have to go through some pretty intensive testing to prove that they're not badly contaminated with anything, for example. And while we've been slamming the American healthcare system here, the FDA is actually 12 years. Okay, I was off quite a bit. The FDA actually is one of the best drug regulation organizations worldwide. If the FDA approves it, it's usually safe and effective. There are occasions where it slips through, but if you want an example, you can look at thalidomide, the story of thalidomide, which the FDA never approved in the US. Other countries did. So it caused horrific birth defects, and it was a drug designed for pregnant women. So the FDA does its job, usually. All right. Epidemiologists are scientists who try and figure things out about epidemics. And when they were looking at the causes of AIDS, they were interviewing a lot of patients, and they'll ask patients, where did you eat? What did you eat? Where have you traveled to? Who have you had sex with? These are standard questions for epidemiologists. And during AIDS, they found overlapping circles of sexual partners. So they would find groups of people who shared sexual partners. This was very suggestive that it was sexually transmitted. And it didn't respond to antibiotics, so it was probably a virus. And they were right on both of those. You may have heard the term patient zero. Currently, this term is used for the first person to have a new disease. We almost never find the real patient zero. It's too hard. We just don't find it. The term was based on a study done in 1984, looking at 40 HIV infected men. And they looked at all of these people. This wasn't the actual pattern of sexual partners here. And they were focused on Los Angeles and San Francisco. So the patient, Rachel, go ahead.
Wasn't the patient zero for COVID at the convention that happened in Boston? Or no?
No. The patient
Or
zero.
no patient zero, but like where it came in from Boston or something.
Well, it did come into Boston through a convention, yes, but it was already in the United States. There were already cases in the Pacific Northwest, and I think it was Seattle area.
Oh, okay.
And it's certainly been carried into the US multiple times.
Yeah. Well, I used to work in a hospital and I quit during, well, didn't quit, but I told my boss I wasn't coming during COVID because I was a tray passer. And I had a sister who was 6 months pregnant. So
Yeah.
I was not gonna be working there. And I remember like how none of us knew in the hospital if there were people there. But later on, I did find out when I was there were COVID patients.
Mm-hmm.
So yeah, I was just wondering, but thank you for answering that.
You're welcome. Okay. So this was research focused on California, and the original person who is now called patient zero, the first person to be called patient zero, was really originally named patient O, the letter O, and that stood for out of California. So the idea was this was the guy who introduced HIV to the communities in California. Well, of course, it turns out they were completely wrong about this. And unfortunately, they actually identified the individual. And he's been blamed and vilified. I mean, he's passed away. He died of AIDS in 1984. Retrospective looks at blood samples show the HIV pandemic was firmly established in the US before this guy got the blame for it. And he was a flight attendant who was very sexually active, traveled frequently, and so he probably did infect an awful lot of people unknowingly. But that's where the term patient zero comes from. Now, once we figured out it was a virus and it was sexually transmitted, the race was on to find the virus. Bob Gallo at the National Cancer Institute, and Luc, I really cannot pronounce French, at the Curie Institute in Paris, were the two leading researchers trying to find the virus.
What
So
virus are we referring to? COVID or AIDS? I mean,
AIDS,
Okay.
yeah. In 1983, I'm going to call him Luke because I can't figure out how to pronounce his last name. Luke and his group found a virus they called LAV. Bob Gallo reviewed the paper that the French group was trying to get published. So when scientists make a discovery, they write it up in a very formalized type of paper and submit it to scientific journals to be published. The journal doesn't necessarily have experts on staff, so they send papers out to experts in the field to review the paper and see if the conclusions make sense, if the experiments show what the writers of the article claim it shows, and that kind of stuff, kind of a fact-checking sort of thing. So Bob Gallo reviewed it. And he argued with the CDC to try and prevent the French lab from getting any specimens to confirm their potential discovery. He's a very powerful guy here in the US, or was a very powerful guy.
You said he was the head of the NIH?
National Cancer Institute.
Oh, sorry. I saw this NIH thing to the bottom left underneath the American dude's picture. I didn't know if that was relevant or not.
No, that's just the picture credit.
Gotcha.
That's where I got the picture from. Okay. So Gallo delayed the publication of the paper, and in 1984, he says, we have found the paper. We have found the virus. And he named it something else. It wasn't named HIV at this point. And in 1985, a different group of researchers were looking at the virus from Gallo's lab and the virus from the French lab and found out that they're basically genetically identical. And viruses mutate fast. They change. It turns out Gallo had gotten samples from the French lab and used that to find the virus. So basically, Luke and his lab discovered the virus. Gallo found out about it and stole credit. Gallo was a bit of a jerk. So one of the reasons for this was they were trying to get a patent for a test to detect HIV. And so the two labs were fighting. And the legal dispute got bad, and the ability to test for HIV was being delayed. And so the French president, Jacques Chirac, and the US president, Ronald Reagan, had to force the labs to share credit. And they renamed it HIV. In 2008, a Nobel Prize was awarded for this discovery. It was only awarded to the French guy. Gallo didn't get it. The time period where this happened, where the discovery was being done, until we had a test for HIV, 50,000 Americans died of AIDS. That's all on Gallo, in my opinion. There's a lot of these stories with HIV, and I'm sure that if we knew more about other early scientific research, you'd see similar kinds of stories. Ego's getting in the way. All right, so we've been talking about this virus for a while. And I want to make it very clear how this is spread. Spread through blood, semen, and vaginal secretions. It is not spread with sweat or saliva or tears or other fluids. It is blood, semen, and vaginal secretions. There we go. That's it. This is a drawing of the virus itself. So, receptive penile vaginal sex, 8 cases per 10,000 exposures. It's not every time. That kind of gives you an idea of how risky that type of sex is. Rape doubles the risk. Remember, we talked about how rape can cause tears in the tissues, and so that's increasing the risk significantly. Blood transfusion recipients. Wow, look at that. 92% of people who receive HIV contaminated blood will get HIV. Sharing needles, 63 for every 10,000 exposures. Needle sticks in a healthcare setting, the risk is lower because you're not necessarily getting into a vein in that case. Receptive anal intercourse, more dangerous than sharing needles. 138 cases per 10,000 exposures. Condom use reduces the risk by 80%. Pre-exposure prophylaxis and condoms combined reduces the risk by 92%. Post-exposure treatment reduces the risk by 80%. So if you know you've been exposed, you can take medications that reduce your risk significantly. Nate, go ahead.
Sorry, I keep talking.
No, questions are good.
So in terms of like the pre-exposure prophylaxis and the post, are they like the same medication? Like how do they differentiate?
I think they're different medications. The post-exposure, so the pre-exposure medication is giving you a circulating level of a medication that is used, or a combination of medications used to treat HIV. So the idea is you already have the drugs in your system before you get exposed. Post-exposure, they give you a much higher dose of those medications. So post-exposure, while it reduces your risk by 80%, you're going to have some really nasty side effects for a week or so while you're taking the post-exposure treatment.
Beats HIV though, that's for sure.
It does beat HIV, absolutely. Yeah. And children born to HIV positive mothers with treatment during pregnancy and after birth, the transmission rate is less than 2%. Untreated, it's much, much higher than that. It has to enter the bloodstream. You can get covered with blood from somebody who's HIV positive, and unless you have open wounds on your skin, you're not getting HIV. It has to get into your bloodstream. So open sores, open wounds is going to increase your risk.
So not mucous membranes like a lot of other infections.
Not mucous membranes unless there's an open wound. Megan, go ahead.
So just to kind of clarify, I'm looking at, 8 cases per 10,000 exposures. So these 8 cases happen to have, a cut of some sort in which the whatever fluids exchanged was able to enter the bloodstream.
Yes.
Okay, that makes it, I only thought that it was from just blood in general, so that helps a lot, kind of understanding that.
Yeah.
They need to have some sort of predispositioned injury in order for it to enter their blood and infect them.
Yeah, you have to have some kind of injury for it to enter the bloodstream. Absolutely.
So sorry, this is gross, but is that why with anal intercourse it's more common? Yeah, I don't really want to get into it, but you know where I'm going with that. Okay.
Yes, absolutely. Anal intercourse, you do tend to get more damage to the tissues. Yes. Julia.
Yeah, I was just saying it's like really shocking to me because when I learned about AIDS, granted, like the school system I'm from is really not the best, but we were taught that it could be spread through saliva too. Yeah. So I'm like really shocked at that.
I think you need like a gallon of saliva or something like that. Am I right, Professor? I remember hearing that when I was a kid. It was like in school. It's like you need like a gallon, which you're never gonna drink a gallon of someone else's saliva. So
yeah. So one of the weird things about viruses is if you get one individual virus of HIV in your bloodstream, you're not going to get HIV. Your immune system can see that one virus and defeat it. You need enough virus that some of the virus slips past the immune system and can infect your cells. So different diseases have different requirements for how much virus you have to get exposed to. I don't know a lot about this, but I do know that some things, a little bit of virus will infect you, and other things you need a lot. And I think that's an example with the saliva. There's just not enough virus in the saliva, and you have to have a cut in your mouth when you get an exchange of saliva. So theoretically, it's possible, but in the real world, no.
So I have a question about like just transmission. So you have to have a cut in your mouth to get it through your mouth, or would like consuming blood or anything like that, could that give you HIV, or is it just if there's a cut in your mouth?
There has to be a cut in your mouth. So you can get it from oral sex if you've got an injury in your mouth.
Okay, thank you.
But yeah, you can swallow it and your stomach acid will kill the virus. Yeah, it's a surprisingly fragile virus. Oh shit, man, we're running late again. If you spill blood with HIV on your desk, the blood dries, the virus is gone, it's dead, it's not infective anymore. So it doesn't take much to kill it outside of the body, but it's very hard to kill it inside the body. Okay, any other questions here? All right. We're going to pick up next time talking about how the virus gets into the cell, the course of the disease, treatment, and more about sex. I will see everybody Thursday.
Thank
Thank
you.
you.
Bye.